Thank you, Mr. Chairman. Mr. Mandarola, I'd like to ask a couple questions. You mentioned the 5 communities that had a higher level, and that the rest of West Virginia had little or no trace PFAS contamination. You mentioned there were 273 community water systems that were tested. Is that correct?
That's correct. There's actually 279, I believe, that were tested. We haven't got results for all of them back.
You haven't. Okay, so let's go back to the history of this, because I think it was probably 3 or 4 years ago, our state was notified, I believe, by the EPA that in the Parkersburg and Martinsburg area, our water systems were above the levels. Is that how the whole thing sort of started for us, correct?
That's correct. Through the UCMR testing of water systems, Martinsburg was tested for PFAS compounds, and it was determined to have above the action level.
So above the 70 parts per billion?
Yeah, correct.
And then they shut the water systems down, right?
That's correct. They took the Big Spring
Offline?
well offline.
Yeah. And then Martinsburg and I believe Vienna was the water system, I think, for the Parkersburg area, then purchased the ability, filters and whatever that would filter this out, right?
That's correct.
That's right. But they're still doing a community assessment, health assessment in the Martinsburg area to see what the effects might be.
That's correct.
Okay. Okay. So if you look at where we started and where we've been, I think that raised huge alarm bells for our state, not only because of the impacts, but one of the impacts in Martinsburg, as you know, was the fact that we had an enormous industrial partner that came, P&G, came to build the state-of-the-art manufacturing facility in and around the Martinsburg area in Berkeley County. And one of the provisos was that clean water would be available for their product. Obviously, that's extremely important in a lot of the manufacturing. And this became the real strain, I think, for Martinsburg to be able to get back online, to be able to fulfill their commitment to Procter & Gamble. Yeah. So
that is correct.
Right. Right. So as we move forward on this, I'm sure there's a lot of trepidation on the community water systems as to what is this going to mean when you know that Martinsburg was $4 million. I can't remember what Parkersburg was. In working with the local community water systems, how are they looking at this as a potential effect in the communities? I mean, I grew up in Glendale. I grew up drinking this water. And so, you know, what are you seeing in the community in terms of what effect, and are they frustrated because they can't really get a drinking water standard that they can really meet the technology to?
To this point, yes. I mean, there's obviously concern over an advisory level versus a MCL,
right?
Issued by EPA. Currently, yeah, obviously, you were instrumental in DOD reimbursing Martinsburg for their water system. The facilities around the Parkersburg Chemours facility, those have all had treatment installed, and it's being done under an enforcement action between EPA and the state and Chemours that it's been in place prior to my coming to the DEP in 2006. They're required to test all public and private sources of drinking water around their facility, and if it's above the advisory limit, they're then required to either replace the drinking water source or supply an alternate source or treat it.
Now, you mentioned when I was talking with you when we first started that Orsanco, which is I won't even try to get it, the Ohio River
Sanitation Commission.
Thank you very much. Is conducting a study of their own. What does that consist of?
They're doing a study that's going to consist of the entire length of the Ohio River. They're doing 20 samples spaced roughly 50 miles apart. They're randomly chosen the first sample and then spacing them down the river. And what it is more of a background level sampling. They're not really doing source tracing at this point, but they're trying to determine, similar to what we were doing in West Virginia, do we have a problem? And if we do, what's the extent of it? Mm-hmm. So they will be doing, utilizing USGS sampling methods to do both depth integrated and with integrated sampling across the river to try to determine,
Right.
is there PFAS and where in the water column is it if there is?
Right, and it's important to note that several of the communities, of the 5 communities that came up above the level, are located along the Ohio River. So
That's correct.
I applaud that for moving forward on that, and I'm ready to keep working with you to make sure we get this right. Thank you.
And that study starts in 2 weeks.
Great, thank you. I want to say, Ms. Stanton, thank you for coming, and I think putting a human face on what the actual effects can be of something that's not addressed properly, that goes on for years, and I just appreciate your willingness to bring forward a very difficult topic for you, I'm sure, and I'm sure that your dedication is to make sure that this doesn't happen to anybody else. And so I just want to thank you for being here.
Thank you. Thank you for the opportunity so much. It's really important.
Thank you. Mr. Meehan, let's talk about a little bit, and I hope this isn't too repetitive where we've been. When I was talking with Mr. Mandarolo, I was talking about the different systems, the 137 systems or something like that we have in West Virginia, a lot of small systems. Obviously, you know a lot about the systems. The cost of fixing this can be very expensive. How do you envision our small water systems? What's going to be the best way for them to face this challenge? Is it repeated testing? Is it a national program for repeated testing? Is it a DOD response that needs to be amped up more vibrantly? How do you see this being able to help? I mean, we got a lot of small water systems in our state, so we understand the challenge.
Well, the challenge of small water systems is PFAS is just part of a whole range of challenges.
Right.
Aging workforce, just maintaining cost. I mean, I was just at a meeting with the California Water Board that said 90% of their violations of the drinking water law is from communities of 500 customers or less. So there's stress there to begin with. PFAS, of course, I was in communication with our colleagues at the National Rural Water Association, and they can tell you that a lot of small communities say, let's take Region 1 New England. I think EPA is requiring for their wastewater systems quarterly, 3 samples a quarter. It gets you up to a couple of thousand. And, again, if you're a couple of hundred customers or connections, these costs are going to be difficult for a small system, not for a Chicago or a Cincinnati, or DC Water. But so there is no easy answer. I mean, it's going to require more resources. It's going to require resources from the ratepayers, from the government, federal and state. And I think when it gets around to, let's say, when EPA promulgates an MCL, as it will on at least PFAS, and maybe a few more contaminants, they're going to build in a system of regular monitoring depending on the endpoints the MCL sets. And hopefully, we'll see, as we've seen in other rules, a monitoring waiver kicks in after a period of time, a year or two, and then you get several years of free from it. So that's all at the margin, though. If you end up getting to treatment, that's where and then the O&M cost and the disposal cost, that's where you really get into the big money.
I will say in our water and wastewater bill that we passed unanimously out of committee, in 89-2 on the floor, we did have a workforce component of that. That was part of we hear this all over our small water systems that while we're both a little sensitive to talking about an aging workforce, we know it's happened everywhere, but particularly it's difficult in this situation. I don't think younger generations see this as a career path, managing water systems and being a part of that scientific community as it's, maybe they have a different view of it. But so we're working on that. Let me ask you, Mr. Mandarola, I know what we're doing in West Virginia, and I really applaud you and your efforts and at the DEP and the legislature for stepping up to this. Are you in contact? I mean, how many other states, I'm sure you're part of a national organization, how many other states are being as aggressive as West Virginia in this? And, couldn't we serve as a shining star here to be able to show the rest of the country how you can proceed and get good results without, completely upsetting the apple cart here?
No, I agree. I always think West Virginia is a shining star when it comes to trying to be proactive on a number of issues. I know, for instance, Michigan and a number of other states, Michigan comes to mind right now, Kentucky was one of them, but have done extensive studies as well. You know, my recommendation would be, there was a lot of fear when we first started this study, because the fear obviously was that we're going to find this everywhere, because in all of the national groups and organizations that I belong to, when there's presentations associated with this, you're dealing with a lot of facilities, as we've heard today, around DOD sites. A lot of states have these DOD sites, and they're finding it everywhere. We have the added bonus of having, you know, a C8 manufacturer in our state. So we were very fearful that we were going to find it everywhere, you know, but the fear of not knowing it was far overcame the fear of what we might find out. I mean, it was extremely important for us to find out what we've got to deal with. And then when EPA comes out with a regulatory scheme for us to follow, we will have the information in the database to take action, and take action quickly, rather than having to go out then and spend 2 years doing a study. So that was our thinking behind it. I think it was a good approach. We addressed every water system that DHHR regulates, which goes down to 25 people. So it's fairly extensive.
Yeah, good. That's good. I think that's good advice, that to be on the front end, to have the data ready so that we can meet the challenge. And Mr. Meehan, maybe that's something that you can help through your organization. Use this as an example of how you can go about it, and be prepared for what we know is coming, and have the data so we can use that science-based approach that I think is the best way for us to meet this challenge.
We've exchanged business cards.
Great, thank you.